You want to support Roland Martin Unfiltered? Be sure to join our Bring the Funk fan club. Every dollar that you give to us supports our daily digital show. There's only one daily digital show out here that keeps it black and keep it real as Roland Martin Unfiltered. Support the Roland Martin Unfiltered daily digital show by going to RolandMartinUnfiltered.com. Our goal is to get 20,000 of our fans contributing $50 each for the whole year. You can make this possible. RolandMartinUnfiltered.com. We've also been focused on is what happens when it comes to black business having access to various contracts. Well, there's equity in that treatment. Remember, we did the story where Congresswoman Bonnie Coleman, as well as the National Urban League and others, complained that the Trump administration was suspending the affirmative action provisions in place in the Department of Labor. Well, there are black-owned companies who are providing services, but they can't even get access to what's happening in the federal government. But of course, if you're DuPont, you can make millions and millions because you got access. Joining us right now is Reginald Swift. He's founder and CEO of Rubix Life Sciences. And Reginald, glad to have you here. You have been having difficulty trying to get access to procurement, and you have products that can actually help people in this moment. Please share with us what you've been dealing with.
Yes. Thank you so much, Roland, for having me on the show. I definitely agree with the sentiments of Dr. Coupe of making sure that we have a continuum of care. And that starts with the innovation itself, right? We are an innovative company, our research and development, and we focus on really how do we make sure that we design personalized care for people of color and minorities to efficaciously create better health outcomes. So what we are looking to do, right, not just from a service side, but also product side, is being able to support many of the physicians, the doctors, NIH, federal agencies on specific activities and products and consumables that they actually need to be able to mobilize their ways of testing. And we've been, having our struggles early on with the CDC when we first detected the coronavirus that came up ashore from from overseas to the U.S. And many of our struggles have been really trying to not just informing the federal agencies, but also mobilizing in ways that we can stand up policy and devices that can actually put these things together. Mind you, we actually created a specific mask that could detect 2 strains of the coronavirus back in January. And this was when we first started on identifying the strain level from what we saw from the animal models.
But hold on. You say your company has created a mask that you can put this mask on and it will detect the 2 strains of the coronavirus?
That's correct. Yes.
Wow.
We've done that, and we actually retrofitted one of our devices that we actually had back when a friend of mine was diagnosed with cancer, lymphatic cancer. He unfortunately passed away before we actually had the opportunity to get it into clinical trials. But we used that platform to retrofit the innovation to then target towards COVID-19 or coronavirus, for as many people know. And many of what we actually are doing is to say not just we are able to invent these things, but we're also able to source consumable product that 3M is making, that many other organizations are making, that are on the market, and we can help communities of color at the same time. And just as Dr. Coupe said, we mobilize our own way to make things happen for us, not just wait for them to make, to drop down the bullet to say, now we're ready to give you some opportunities. We're just doing it on ourselves.
What about testing? Any luck whatsoever there in trying to get to the CDC, to get on the federal level to assist with that?
So I'm glad that you asked. So many of what we're actually accomplishing is not just being able to just network with the CDC, but we're also focusing on obtaining material. We actually have 1 million tests available that we can actually go into the communities right now and test 1 million people. So we're not waiting for the CDC to come to us to say, okay, can you disperse your product to many of the communities that need it? Because what we saw is that many of the resources that they do have for the Defense Production Act aren't going to Michigan. They're not going to Chicago. They're not going to Louisiana. They're not going to many of the majority states that have the majority of African Americans. So we're mobilizing our ways to get into these Department of Public Health groups to say we're here and we're here to help you. So and we can stand up a million tests.
So y'all have, okay, so explain. So you say you have 1 million tests. you have the ability to administer and process them?
So yes, we can actually mobilize both from a processing standpoint and as well as a detection standpoint on being able to say whether you have COVID-19 or not. And it was actually we got lucky because it actually came from a connection of ours from the Air Force in which we were able to source 1 million of these test kits. So we have 1 million in our shelf right now that we're ready to just mobilize it and get it ready for people who actually need it.
So y'all have right now, 1 million tests for COVID-19 that you can administer and process?
That's correct. Yes.
Wow.
That's correct. And
you haven't been. So what happened? Do you need to get approval from CDC or so?
No. So I'm glad that you asked. So the products in themselves are already approved by the FDA.
Okay.
So we don't need to have any specific direction from the CDC to mobilize any contingency to stand anything up. All we need is to have collaboration between a physician network, healthcare provider network, and just people who actually want to mobilize people to really get tested. That's all we're waiting for.
Wow. And so when you hear Donald Trump a month ago in the Rose Garden say, oh, we're going to have drive-through testing at CVS, Walgreens, and Walmart parking lots, but then we don't see it, that surely you're like, wait a minute, we're ready. What are y'all going to do?
That's right. That's right. And one of the things that we realized up front, and as we logged on and we became a part of the White House task force, and yeah, we're on the task forces as well. We realized that many of the sentiment and the intent of what we expected to happen wasn't going to go in that direction. So we wanted to then shift our gears to say, let's mobilize community action and community groups that want to be able to say, listen, from a person that is actually on the ground, boots on the ground, that have done this work before. We've actually done this type of mobilization overseas. We did this in India. We did this in Nigeria. We did this in Morocco for infectious disease. So when we're looking at, the issues here, we're confused as to how we can't even get in front of the right people to really help mobilize these tests, because we've done it effectively overseas for infectious disease, for even ones that you have to put a suit on. We're talking about the whole suit from head to toe.
Questions for my panel. Who wants to be up? Amisha, Robert, and Michael. Who's got a question?
I do.
I'll go.
Amisha, go first.
I think I'm extremely interested. Well, first of all, thanks for all of your work. I'm extremely interested in the testing project you're doing with the mask specifically. Why is that something that you're looking to have mainstream to catch on with some of the national organizations? Is that something that you've had conversation with around pushing with the CDC? How does it work, beyond the work that you're doing?
No, of course. So we actually have one prototype, and this was of the mask, right? So one of the things that we actually did back in January was we sent this mask out to the Philippines. And we got enough data points to say from a efficacy level or how much does it work towards detecting this strain or two strains. We saw from 44 different patients that it did, at least from 96% of the time, it detected it correctly and it detected it accurately. So once we got enough of those data sets, we're compiling the report as we speak right now so we can send it to the FDA so we can get this prototype approved for Emergency Use Act. So once we are able to do that, we're looking to scale up the manufacturing of our prototype to then design it in a way that many, many other groups can use across the nation, not just focusing on what we're doing here, because it's no good on the shelf.
Michael.
First, congratulations for all the great work you have done.
Thank you.
How do you do how have you monetized the kits? Is it proprietary? You can't tell us how much you charge, or how does that part work?
As far as the kits that we're able to source, it's as competitive as many of the other kits that we have right now. I mean, as you can see on the market. So it's not really proprietary. It's really just the same amount that we could charge. But again, these were already bought and paid for because of our connection with the U.S. Air Force, and because there was a direct link to say they were actually going to try to mobilize these test kits, but eventually that became a part of the surplus. We now have 1 million in stock that we just need to use.
Robert.
Got it. Thank you.
Yeah, with regards to your supply chain issues and regulatory issues, who have been the partners you've worked with in both the legislature and the regulatory offices in order to try to fast track this? What we saw was when the president heard about hydrochloroquine and chloroquine on Twitter, for example, all of a sudden he was able to push that through into wide-scale testing almost immediately. Who have you been working with, and who would you like to work with in order to put more pressure to get this fast-tracked?
Well, I'm glad that you asked. So we have a lot of great collaborators. We actually, I made some great collaborators, made some great friends from UVA, Dr. Ebony Hilton and Dr. Leanne Webb. They're helping us mobilize opportunities within the hospital provider supply chain within the Virginia legislature and the groups down there. For us, it's been a struggle because we've actually tried to interface with with Ayanna Pressley and Senator Elizabeth Warren. Yet, it seems to be a slow traction of trying to be able to get them in front of us and say, listen, this is what we did.
Hold on.
You're
trying to reach Congresswoman Pressley as well as Senator Warren to do exactly what?
So we're trying to be able to mobilize from their standpoint how they can help push our vehicle forward so we can get into many other states, as well as being able to use the resources of Massachusetts so we can use our testing kits to get into communities like Lawrence, Massachusetts, or Dorchester, Massachusetts, or Jamaica Plain to really stand up programs to get our testing kits available to these guys that are in need.
So one second, you've been able to get into other states, but you have issues getting into Massachusetts.
Yeah, ironic, isn't it?
No, that's fine. First of all, you understand, that ain't nothing but a text message. So I just want to be clear. You're trying to get into Massachusetts, and you're trying to get access to Congresswoman Pressley as well as Senator Elizabeth Warren, right?
That's correct, yes.
Okay, all right. Well, they ain't nothing but a text message. So, but go ahead with your answer. Go ahead.
Okay, no, I definitely appreciate it. And we actually tried to mobilize an opportunity within Detroit and as well as Chicago. But yet we face a lot of higher scrutiny to be able to mobilize what the same drive-through types of activities that 3M and many other pharmaceuticals companies are able to do. But for us, it seems to have that slow walk to approval. So one of the things that we've been able to do is to try to find a way to work with many of our collaborators to help mobilize ways to get in front of individuals that, such as yourself and many of your panelists.
Well, here's what we'll do. This is just real simple. What we'll simply do is we'll just simply connect you with Congresswoman Karen Bass, who's chair of the Congressional Black Caucus, and then again, all the CBC members are there, and so that's very easy to do.
Oh, I appreciate it. Thank you so much, Roland.
Okay. All right, panelists, any more questions?
I would just like to say if he needs any assistance, the Rainbow Push Coalition, of course, we will be glad to speak with him and making connections that we can. So if he would like to reach out to me, I'll send him my email address and contact information on the back end.
All righty, sounds good. Reginald Swift, we appreciate it, man. Thank you so very much.
Thank you so much, Roland. It's been a pleasure.
All right, folks, got to go to a break. When we come back, more Roland Martin Unfiltered. We're going to talk about this crazy story out of Florida. Inmates making masks for correction officers and not for themselves. This country has lost its damn mind. I want you to like, share, and subscribe to our YouTube channel, youtube.com/Roland S. Martin. And don't forget to turn on your notifications.